Welcome to Boulder, Montana Community Analysis. 1862 started as a way station between Fort Benton and Virginia City, which was the current capital of Montana at the time. 1865 it was incorporated, later becoming the county seat for Jefferson County. Pictured is the county courthouse on the National Register of Historical Places. Boulder Hot Springs Hotel was established in 1863. It too is on the National Register of Historical Places. 1893, Montana School for the Deaf and Blind opened, a precursor to the current Montana Developmental Center, MDC. You'll see the brick building is the old administration building, also on the National Register of Historical Places. If you look to the right, you'll see like a house that is one of the community homes located on the MDC campus. Gold mining brought people to Boulder. They found that mining maybe wasn't their thing, so they started farming and ranching under the Homestead Act of 1862, and that continues today. Population-wise, very small, a little over 1,200 people, predominantly white, and males and females pretty equal. As you can see, the largest employer, over 10% of the Boulder residents, it's MDC. Boulder sits at about 4,904 feet in elevation, and size-wise, it's about 1.14 square miles. It's located in a valley within the Rocky Mountains, the Elkhorn Mountains particularly, and surrounded by forest public lands which afford hiking, camping, fishing, and hunting activities. There's also abandoned mines and ghost towns in the area. MDC and its precursors really have played a major part in shaping Boulder. Since 1893, there's always been a residential program for persons with developmental disabilities in Boulder. In 2015, the governor says that MDC had to be closed and that the deadline is 2017. With its impending closure, the community faces a loss of income for residents as well as revenue for itself, and literally identification as a community. Schools. Jefferson High School is one of two high schools in the county. It serves the North County. There's also a junior high and an elementary school. Pictured is the high school. Boulder Community Library is the hub of the community. It has computers with internet access. It has a meeting room for small groups, offers classes, has homework assistance, story time for children. Staff is supplemented by a great many volunteers. Big Boulder Apartments are the low-income housing for Boulder. There's about 35 apartments. Downtown, there's the grocery, there's a hardware store, there's liquor stores, there's restaurants, there's auto repair, all the basic services that you need for a town. But if you needed clothing or shoes or something, you had to travel into Helena, and that's about 30 miles away. So that is a concern because those type of items are not available. Average income is between $21,000. Unemployment's at 4.7, and Boulder's a little bit older than other communities, being the median age is 46.2. It is a little bit higher educated, with only 11% of those 25 and older without a high school education, possibly because it is the county seat and you have county administrators, directors, and managers in the area that have jobs that require higher education. Leading cause of death in this area is cancer, followed by heart disease, and citizens are concerned about substance abuse, environmental issues, and a need to increase healthier lifestyles and behaviors per the community assessment 2012. Communicable diseases are fairly rare. Substance abuse is a major concern for the area, with only 20% of the teens having never used alcohol compared to 85.8 nationally. Cirrhosis deaths in Montana, per the community assessment, was listed at 52.3 per 100,000 compared to 9.1 nationally. So obviously alcohol abuse is an issue in the community. I read one study that showed that the earlier a child is exposed to substances of concern, such as alcohol, tobacco, or illicit drugs, the more likelihood of a lifelong addiction, especially among rural teens and diverse teens. It also found that rural youth were more likely to use alcohol, tobacco, and methamphetamine. The upside is that drug prevention programs aimed at younger children have shown success. So, as a community health nurse, we would focus on programs with prevention and education geared towards elementary school children. Here are some of the parks in the area, particularly the Jefferson County Park on the right is being restored. It had been the farm for the Montana School for the Deaf and Blind. But what you want to notice is there's no handicap access, there's no sidewalks, there's no walking paths per se, and that is a concern for the citizens because they want more exercise areas, more hiking paths, more level surfaces, and that's just not available at this time. The Boulder Basin Senior Center provides meals and recreational activities to senior citizens. Transportation is provided especially for those from Basin, which is about 8 miles away. It's funded by the CNC Thrift Store and volunteers. Wastewater treatment facility was a major project for the community, a major budget item, and it was replacing the old facility, which is in the Boulder River floodplain, which was a potential environmental disaster. This facility will help the community meet the requirements for the Montana Department of Environmental Quality, thus avoiding fines. Currently, they have some exceptions going on with the state. Boulder and Bull Mountain Volunteer Fire Department headquarters, along with the Boulder Ambulance. The police, according to the chief, work from home. But police calls have been up 300% since the announcement that the facility is closing, partly due because of the residents acting out due to staffing issues. Many people are leaving, they're getting other jobs right now and leaving the facility, and the uncertainty of the residents. These are people who have developmental disabilities that found their way into the criminal system. They're court appointed, they're court ordered for placement at MDC for rehabilitation, and many of them have mental health issues in addition to the developmental disabilities. Many of them have been rejected from community placement in the past, so this is playing into their uncertainty. The other concern is potential for natural disasters from flooding, earthquakes, and severe winter storms and forest fires. And again, the substance abuse issues, though the police chief told me that complaints related to substance abuse, alcohol, drug dealing, so forth, have actually decreased. Transportation is an issue because to get to a medical specialist, department store, urgent care, emergency room, or whatever, if you don't have a car or a drive, then you're going to have a difficult time because those services are located about 30 miles away. The other concern is the lack of anything on the agenda for increasing the sidewalks or upgrading the parks for greater handicap access. Health-related resources, the Boulder Medical Clinic and the Jefferson County Health Department are both housed in the building that is pictured. There are mental health services, dental services, there's the pharmacy, and there's home health that's provided in the area out of Helena. The closest hospital is St. Peter's Hospital in Helena. I focused on the Healthy People 2020 objectives for this community that is based particularly on alcohol abuse. And as you can see, the reasoning being that we do have indications that there is a lot of alcohol use amongst the teens, and those teens are going to become our adults, and so we want to continue education and prevention to meet the objectives in 2020 with these people. access to the government. It's a small town. People know each other. The chief of police was very willing to talk to me. City meetings are open, and the Boulder Monitor, the local newspaper, always has a page full of citizen responses to current issues. Our concern, it's a global community issue, would be safe drinking water, and also the preparation for possible natural disasters, which would affect the drinking water, is a concern here in Boulder as well as many parts of the world. We continue monitoring the river and streams for contaminants to prevent exposure to health risk. And we plan for those disasters, which can lead to contaminated water sources and loss of basic sanitation. And we know that many developing countries still lack basic sanitation, so we focus on our disaster plans to prevent those things. Community health nursing is just not necessarily geographical, in a sense it's just the one community. The world's the whole community, and so what we do in our community affects others. So we want to participate in activities to learn more about the world health concerns and the global issues, because our experiences have shown, such as Ebola, HIV, the disease and pollution knows no boundaries. Thank you.